Hey, my name is Dr. Sean Price, clinical coordinator here at the Fix in Fort Walton, and we're going to do this video series on why chiropractic doesn't work. Now let me be very, very clear. Chiropractic is very effective. I am a chiropractor. I love moving bones. I love aligning the spine, and it can create miraculous healings for people. There are situations where we see patients in our office who have been to a chiropractor, who have received multiple chiropractic treatments, and that the treatment didn't work. I personally have a personal experience that I'll go into in one of these videos that I personally experienced that where chiropractic didn't actually work for me. But the first one I want to talk about is chiropractic in and of itself. And what it is basically chiropractic. When we're moving joints, when we're aligning the spine, we're basically clearing the signal from the brain for the brain to get the signal from the brain to the body. And if you have misalignments in your spine, that will interfere with that signal getting from the brain to the body. So it's called a subluxation, and that can cause interference of that signal. So if the signal doesn't get to the body part appropriately, the body part's not going to carry out the right function. And if you lose malfunction in the body, then eventually that turns into a state where you start having symptoms, you get into chronic pain, and sometimes it can affect the organs as well. So the first thing I want to talk about is the importance of the brain with regard to chiropractic treatment, because the whole concept is that your brain sends a signal to the body, because the brain controls and coordinates the function of every cell in the body. So the brain sends a signal to the body for the body to carry out function. That is a healthy body. When that happens, the body is in a state of ease, or the scientific term is called homeostasis. So for chiropractic, where chiropractic comes in is if there's interference in the spine, called a subluxation, well, that means that we're not getting that signal from the brain to the body appropriately, so that's going to lead to malfunction, and then could eventually lead into disease, so on and so forth, in degenerative joint disease and so on, and symptoms. So removing the subluxation clears the brain-body pathway, allowing the body to function and heal and get it back into a state of ease. That's the chiropractic theory. So problem number one, if you get adjusted and it's not working properly, what could cause that? Why is the body not restoring its function? Well, item number one is it could have been brain function. What if your brain is not functioning properly? What if your brain has lost functional capacity because of brain trauma? What if it's lost functional capacity because of inactivity? What if it's lost functional capacity because you've had a subluxation for so long that the brain has been sending the signal to the body, but that subluxation has been interfering with that function for so long that the body was not functioning properly, so it was sending the abnormal signal back to the brain, and the brain was responding appropriately, and then all of a sudden the brain started losing normal function. What if you have a metabolic disorder? What if you have a thyroid disorder? If you have a diabetic disorder, or some other metabolic disorder, something like that. There are a lot of different things that can cause the brain to not function properly. And what do you do in a situation like that? You implement brain-based therapy, which is what we do at the Fix. So a lot of times we can have patients that come in who have been to chiropractors, who have had treatments done, and maybe didn't respond as well as they wanted to, or couldn't hold their adjustments because their brains weren't functioning properly, their cerebellum wasn't functioning properly, so the spinal muscles, paraspinal muscles wouldn't hold the adjustment. Maybe the parietal lobe is hyperactive and your parietal lobe feels pain. So now your parietal lobe becomes overactive and starts feeling pain that's not there. It's actually not a subluxation-based problem, it's a brain-based problem. So you've got to make sure that the brain is working properly. So if you're in chronic pain and you've been to a chiropractor and it's not working for you, or it hasn't worked to the level that you hope, doesn't mean that chiropractic can't work. It just means that there's something additional going on. There's a loss of that brain function. And again, the way that you resolve that is you go through a complete neurological evaluation, determine the parts of the brain that have gone weak, and then you go through brain-based therapy to re-strengthen those brain functions through neuroplasticity and rebuild that brain function, and you can actually restore that health and get the goal that you initially went for without the use of drugs, without the use of surgery. All right, I hope this makes sense. Please feel free to post any questions or give me an email, give us a call at the office, anything that we can do. If you want more of these videos, please be sure to subscribe to our YouTube channel or like us on Facebook. All right, see you on the next video.